I think as we listen to that opening panel, why are we so focused on this area? Well, it isn't just saving one life that saves the world. It isn't the unbelievable results of having a loved one survive a life-threatening disease or preventing that issue. Those are priceless. But in the economic argument in Washington and the rate of return on investment of federal tax dollars, the issue we always want to underline is that 50% of all economic growth that's occurred in the last 2 centuries can be traced to advances in public health and medical research. As we all know, there's 3 real areas of healthcare spending: prevention, treatment, research. And as we looked at the landscape around 25 years ago, we first started with we needed to rethink, quote, the war on cancer, which was defined in the early 1970s. And many of these issues were not at the forefront as we think back to this list we made in 1993. Internationalization of this effort, it's not just U.S. Investing more money in this area. Recruiting the best and brightest, one of the greatest challenges in any business or area. Coordinating these activities. Accelerating technology transfers. Creating this library of chemicals. Accelerating approval for new drugs. And getting patients involved in their families. Well, the world has changed in the last 25 years. And as I think back to some of the events that helped change the world, the first ever National Cancer Summit in 1995, bringing together groups here in Washington, and the first ever program on Larry King, where we went on to try to identify patients who had families that had more than one person in the family that had the same disease. Interesting that modern technology in 95 had never been used. And in a study by Johns Hopkins that took 12 years to recruit brothers, sisters, others that had similar cancers within a family, it took only 1 week using, quote, the modern technology of television. The efforts of tens of thousands of people, leaders in Congress, White House, and many others around the country culminated in 1998 with the march here in Washington. 250,000 people in Washington we brought, and 250,000 around the country. With the leadership of so many, the president then signed into law the doubling of the NIH budget over the next 6 years, the tripling of the NCI budget, substantial increases in NSF, CDC, and so on. But that, for the most part, ended in 2004 as we tried to figure out, as Chairman Upton pointed out, this lack of funding, lack of growth of funding, when you can see adjusted for inflation here, that quite possibly we'd lose an entire generation of young scientists who had devoted a large part of their life in undergrad, grad school, internships, fellowships, residencies, and so on, but there was no funding for their work at the end of a 15-year post-high school journey. So in 2003, Faster Cures was formed with the concept of an organization, longer name, the Center for Accelerating Medical Solutions, dedicated to shorten the time to find cures and better treatments. Saving time was saving lives. We use this cartoon from Benjamin Franklin, 1754, Join or Die, when he was trying to convince the colonies that if they did not combine, they would not survive. And so as we looked at the bioscience infrastructure We looked at each of these separate pieces, whether it was the NIH or whether it was patients or DARPA or FDA or pharma and bio, and so on, to figure out how we could get them to collaborate in public and private partnerships to make the difference. And with that, we put into motion Partnering for Cures, bringing all these constituents together, and with the idea that we'd have a focus on new technologies, but we'd also have a focus on the disease-specific, building the disease-specific organizations. We looked at innovation as a group in this, and had a retreat here in Lake Tahoe, the concept of accelerating innovation and the bioscience revolution. This eventually led to the celebration of science here in Washington, a reaffirmation of the United States' commitment to the biosciences occurred here just 4 years ago. Outgrowth eventually was the passing of the National Center for Advancing Translational Science, but a reaffirmation of the commitment to bioscience and the opportunity that we are entering a new age of medicine. And whether it's cancer vaccines, stem cell treatments, powerful new diagnostic tools, immunology drugs, etc., how an individual with a life-threatening disease will be treated will change forever over the next couple years. There were a lot of challenges to this effort. 1987 New York Times article pointed out that at the rate we were sequencing genes, we would not accomplish the sequencing of the human genome to the 22nd century. However, we saw by 2003 that this project had been completed, 13 years, over $3 billion. Today, in many of the leading centers in this country and around the world, it's a couple hours and the cost approaching $1,000. As we look at the cost of sequencing the genome and the concept of Moore's Law, we can see here that the sequencing of the world's largest data file, human genomes and others, has dropped substantially faster, and recently the cost and time are dropping off a cliff. Recently, a Georgia Tech PhD student indexed the human genome in 7.3 seconds. 7.3 seconds, down from 13 years. The world's fastest computers today can do 34,000 trillion calculations a second, and there is no chance that a human being is ever going to beat the best programmed computer again in chess, as it can play every move. So as we stepped back and looked at what was going on in research area, we noticed an enormous diversion of talent, of human capital, and dollars had been diverted to a change in because of the change in weight and other factors in our society. So here is your first participation quiz of the day. There will be many more to follow. According to the World Bank, which of the following social burdens has the greatest direct economic impact worldwide? Climate change, illiteracy, smoking, armed violence / terrorism, or obesity? So I'll give you 10 seconds to think of your answer. It's now time to vote. So, according to the World Bank, which had the greatest economic impact worldwide? Climate change. Anyone voting for climate change? Just raise your hand. Don't see a lot of hands out there in the audience at the moment. B, illiteracy. A number of hands. C, smoking. D, armed violence, war, terrorism. E, obesity. Number of hands. Okay, let's look at the results according to the World Bank. Smoking, and here's how they ranked them in economic terms. $2.2 trillion from smoking, armed violence, terrorism, 2.1, obesity, 2.0, alcoholism, 1.4, illiteracy, 1.3, and climate change, $1 trillion. And you can see how this gravitates to public health in many issues here in terms of what is the cost to the world. In terms of lifestyle makes a difference, all of our work at the Institute, which culminated in 2007 with a report on an unhealthy America by the Institute, is that we estimated it cost the United States $1 trillion a year. You want a growth engine for the U.S.? Just the change in weight from 1991 and looking at 7 chronic diseases, out-of-pocket costs, presenteeism, absenteeism. We had the first ever open meeting with these various groups from private industry, public at the CDC, January 2004. So as we focused our attention on bringing the groups together, you can almost sense it in the media today. Just a week or so ago, cover of the New York Times, 2 of the 6 cover articles in the New York Times were on public health. Yesterday, time with the kickoff to our Summit on Public Health in the Wall Street Journal, an entire section on public health. A test that could limit antibiotic prescriptions. Hospitals' quest to prove exercise can affect the growth of cancer. The risk of supplements, interaction with pharmaceutical drugs, vitamin size cameras to reach every part of the biome. This is the Wall Street Journal. This is the front page of the New York Times. And so this meeting that you've joined us at, and we want to thank you for joining us, we have redone Benjamin Franklin's snake. As we think of the different groups that are represented here, schools of public health and universities, insurers, disease research organization, large employers, expense management and behavioral management companies, retail and consumer products companies, philanthropists, bio and pharma, NGOs, diplomatic corps, government officials, and health providers are all combined in the audience today with the idea of how can we team up to use modern technology today and the knowledge that sits in our schools of public health throughout the world to move prevention and wellness to the forefront today. As Margaret Mead pointed out, never doubt that a small group of thoughtful, committed citizens can change the world. Indeed, it is the only thing that does, and you are part, each of you, of that small group of committed citizens. Thank you for joining us today.